Hello, I'm Lena, and I'm excited to be here with Dr. John Ransom today as we announce a new fund called the Heart of Faith Fund. Heart disease is the leading cause of death for men and women in the United States and Arkansas. And Baptist Health is working to change that, but we need your help. This new fund will help support the important work of Baptist Health Transplant Institute, as well as the patients who are in need of life-extending cardiac care.
Our history sort of goes back to 1989 when we did our first heart transplant on November the 10th of 1989. Following that, our program developed in the 1990s. We needed a way to support some of these very sick people till we could get a heart to transplant them. And in 1999, the FDA approved the first durable or long-term assist device for these hearts. It was called the HeartMate. And that same year we did our first HeartMate, which was the first in the state. In 2015, we were the third largest center in the country in the use and development and acceptance of the HeartMate 3. And that's the one that we use now. Just this last month we did our 500th HeartMate, which is a pretty good number. So in 2010, opened our Transplant Institute, and that's something that we're really proud of, because not only do we do transplants and durable left ventricular assist device or HeartMates for long-term support, and people live with these for a long time, transplants. But in addition to those two therapies, we have in our institute a very active heart failure program for people who don't qualify or need that sort of therapy. And then recently we've opened our ECMO program that's for the acute heart failure patients that to allow them to live until they can get a transplant or one of the durable VADs or assist devices. So we're the only center in Arkansas that supplies the full gamut of treatment of heart failure, and we have for quite some time. One other thing, in 2017 we did the state's only total artificial heart. A young man named Chadarius from Jonesboro, we placed that in him, kept him on the total artificial heart for a year and a half, doing very well at home, and then we were able to transplant him. Since then he's returned to Jonesboro and he's living a pretty normal life for a 23-year-old. Very nice young man, and we're very fortunate to be involved in his care. First of all, a lot of our patients live out of state or, at the edges of the state, and it's 3 or 4 hours for them to get here. If they don't need to be hospitalized, they can't afford to stay somewhere, so we use that, or would use that, for hotel lodging for them. Some of them, when they're recovered enough to leave the hospital, but we don't want them to go for that distance to be away from us for a while, we keep them in the hotel for a while. So that's one important thing. Some others is some of our patients, their insurance doesn't cover at times some of their medications that's required for the transplants. We would use it for that, and we're responsible for making sure they have those medications. Some of our patients don't have the ability to come back and forth to see us in the clinic, and we use that for transportation to and from the clinic to see us, or from moving them from one hospital to another to get them here. So there's so many things that would allow us to do. And in addition to that, in the clinic here, there's often something that's needed that we can't afford to get, and the fund would help us to supply those needs. So it would be greatly appreciated and be very useful to help treat our patients.
Thank you, Dr. Ransom.
Sure.
So thank you. We hope you will go to our website at baptisthealthfoundation.org, look for the Heart of Faith Fund, and help us to continue saving lives and providing life-extending care for the patients who need it here. Thank you.